Pagdating sa physical appearance, isa sa talagang mas pinagtutuunan natin ng pansin ay yung ating mga buhok. Madalas, pinabago-bago pa natin yung mga styles o hairstyles bago tayo lumabas ng tahanan.
Pero paano na lamang po kung mapansin ninyo na grabe na maglagas ang inyong buhok
Yun.
at biglang may patse-patse na sa anit po na wala ng buhok? Baka po yan ay alopecia na.
Kaya naman dito sa DOK ay may libreng telemed po tayo patungkol sa Alopecia Areata. At makakasama natin para dyan si Dr. Joyce Dancel Shuti, isang dermatologist. Good morning po, Doc, at welcome sa Rise and Shine Pilipinas.
Hello, good morning.
Dr. Joyce, magandang umaga po. Dayan po ito with Audrey. Doc, maaari niyo po bang i-define o ilarawan po sa amin? Ano po ba itong alopecia at scalp lang po ba ang maaring maapektuhan po nito, Doktora?
Okay, so alopecia areata, so it's a type of a non-scarring alopecia. So it means na hindi po to, yung hair follicle po natin hindi na apektado. Tapos it is an immune-mediated type of alopecia, meaning our own immune systems are attacking our hair follicles. Tapos, hindi po ito masyadong common because it only affects 1 to 2% of the population. And it affects mostly children and young adults, although it also affects at any age. Tapos, what usually happens is that there are a few or multiple na parang bald spots or bald patches on the scalp. So that's what we call patchy alopecia. Or kung merong madaming, as in the whole scalp na is already affected, so that's what we call alopecia totalis. However, it also affects the whole body. So it can also affect the scalp and even the eyebrows, eyelashes, and body hair. So that's what we call alopecia universalis.
Okay, totoo po ba, Doktor, na stress ang isa sa dahilan ng alopecia? At ano pa ba ang iba pa pong sanhi nito? Kasi may mga bata, meron nitong mga ganitong kaso.
Yes. So the possible causes of alopecia areata would be a genetic cause, meaning namana po natin ito sa ating parents, yung genes, and of course external factors such as emotional stress. It could be from in physical injury or from illness. So lahat po ito nakaka-affect sa ating immune system. Then another cause is like no other cause. There's no factors that can be attributed. So parang it just happens, it just occurs randomly. So those are the possible causes.
Okay. Dok, ano po yung mga sintomas na maaring may alopecia na po ang isang individual?
Sometimes you don't even know na hindi natin na-realize na meron na pala tayong alopecia. Kasi there are patients who just come in after many months na meron daw nakapansin na family member, or even if nagpunta sila sa salon, dun lang nila nalaman na meron pala silang bald patch because it could be asymptomatic, so meaning walang nararamdaman. So tapos the other causes, the other possible symptoms are related to the physical illness. So, but sa hair itself, usually walang nararamdaman.
Okay.
Okay, pero temporary lang po ba ito, Doc, o permanente na? Considered ba ito na autoimmune disease?
So, it's usually temporary. So, what I tell my patients is that 80% of the patients would have regrowth of the hair within 1 year. So, it's also non-scarring, meaning there's a possibility that the hair would regrow again.
Okay. Ano po ang maaring gawin po ng isang pasyente, Dok, kapag meron po siya nitong alopecia to minimize po yung hair loss o pabilisin po yung hair growth?
Okay, so what I usually advise the patients is that first is to reduce your stress levels. So I would advise them na as much as possible, catch up with your sleep, and also have a well-balanced diet. So a lot of fruits and vegetables, and increase your protein intake, but also decrease the processed food that you eat. And then I would also advise them to reduce or avoid smoking and reduce and avoid drinking because that can also affect our immune system. And then for some patients who have a very tight hairstyle, I would tell them to loosen their hairstyles because it can also cause another type of alopecia, yung nakakalbo na areas dito sa hair na sobrang pag-pull ng pag-pull ng hairstyle. So we can all benefit from that as well. And then you can always use mild hair products, mild shampoo, conditioner, and hairstyling products.
Okay, basahin ko na rin itong katanungan ng ating mga netizen. 2023 na po ngayon, Doktora, may mga bago bang procedure o bagong pamamaraan para magamot ang numinipis na buhok?
Okay, so there are possible treatment options, but I always tell my patients that alopecia areata is a little bit hard to treat because there's no treatment that is 100%. So first, if I see the patient with mild or less than 50% of the scalp is affected, so I would recommend something topical. So first, topical steroid or topical solutions such as minoxidil, and sometimes I would even recommend an intralesional therapy such as injection of steroid directly to the scalp. And then if I see the patient with more than 50% affected, then I would suggest an oral or systemic type of treatment such as systemic corticosteroid therapy or other immunotherapies. But then again, it would depend on the patient and the doctor that would see the patient. There are that's not really new, but there are studies that would come out, such as phototherapy, so UV therapy, ultraviolet therapy, or lasers that can also have a good outcome. So these are the possible treatment options.
Okay. Doc, nabanggit nyo kanina na ito ay common sa mga bata. So affected po talaga kanila yung kanilang self-esteem. Ano po ang pinapayo po ninyo sa mga bata, maging po sa mga magulang, para habang nararanasan po nila itong alopecia ay kumbaga naiiwasan naman po yung pagbaba ng kanilang confidence?
Yes. Alopecia areata can really affect the self-confidence and self-esteem of the patients, especially if they experience bullying or anything from school or from the workplace. So I would suggest also that they can see a counselor about it to better deal or cope with this condition. However, I would tell my patients that alopecia areata is not a permanent condition. So most of the time, 80% of the patients would have a regrowth. So they still have hope. And then there are many treatment options available. So if the patient experienced na meron sila, nakakalbo sila, so they can visit their medical doctor or dermatologist for further education and counseling.
Okay, Doc, marami kang binanggit kanina na pamamaraan para magamot ito, pero hindi mo binanggit yung hair transplant. Hindi ba applicable yung hair transplant sa may alopecia areata?
Well, alopecia, as I discussed earlier, alopecia areata is a non-scarring type. So it means there's still hair follicles there. For hair transplant, we would get that hair from another part of the scalp to transplant it on the hair or the scalp that there are no longer any hair follicles. So this is not really recommended for alopecia areata.
Okay, well, maraming salamat po sa Live-in Telemed ngayong umaga. Dr. Joyce Dancel Shuti. Thank you po, Doc.
Maraming
Thank
salamat,
you.
Doktora.